I'm Dr. Carly,
I'm Dr. Hoot.
and this is Real Talk with Holistic Docs. So, today we are covering a subject that is relevant to literally every single woman in the world, not just the United States, but the world. If you are a woman and you are alive, you're gonna want to listen to this one. That's right, guys. We are talking about menopause. Bum, bum, bum. So, like I said, this is something that every single woman is going to experience at some time in her life.
Mhm.
And we are not fully equipped with the information that we need to gracefully go through menopause. And in fact, a lot of times we've been told that it's just going to be this really sucky time of your life and you just have to get through it.
Mhm.
And both Dr. Hoot and I disagree with that assessment and think that there's a lot that we can do as naturopathic doctors to help women make this transition in a way that doesn't affect their quality of life in such a big way.
Mhm.
Without further ado, I am going to let Dr. Hoot take it away and tell us a little bit more about what exactly menopause is from a physiological level.
Yeah, so menopause is defined as not having had your period for 1 year. The time before that, when you're kind of having irregular cycles, is called perimenopause. It happens around age 50, 55. There's some genetic components to that, but generally it's around that age. What's happening is your ovaries basically get tired, and evolution says you're done, essentially. So your ovaries start to slow down, stop making estrogen and progesterone, stop releasing eggs so that you can no longer get pregnant, right? So because the menstruation, regular menstruation is what allows us to get pregnant. And this is evolution's way of saying that you are no longer needed, which is why all of the terrible side effects of menopause are essentially associated with aging, because you're no longer needed to raise a child. So some of the symptoms are night sweats, hot flashes, which every menopausal woman knows very well. And those are some of the horrible symptoms that generally we are told are not avoidable, which I'm here to tell you are definitely avoidable and treatable. Weight gain is a huge one. Fatigue is a huge one. Brain fog, as we're going to talk later, is a big one. Reduced sex drive, skin changes, all kinds of things. So that's basically the definition of menopause. Now, the risk factors associated with it, we kind of talked about this, I think it was our last session or maybe 2 sessions ago when we talked about women's health. But low estrogen essentially means that you have low bone density, because estrogen helps to strengthen your bones. So when you enter menopause and you start to have low estrogen, you really have to focus on your bone health, which we'll talk about in the future what that means. Now, I do want to mention, low estrogen doesn't only happen in women. It can happen in men. And in men who have low estrogen, they also can get osteoporosis. So this
Right.
is not just a women's thing, but it is
Yeah, that's a
definitely
really
more.
important thing to mention, is that
Yeah.
estrogen is equally as important for men as it is for women,
Yeah.
specifically for that reason.
Yeah.
It also helps with cognitive function as well.
Yep.
So low estrogen in men can be associated with poor cognitive function too.
Yeah,
So
definitely.
just something to consider, if whether you're a practitioner or you're a patient, understand that all of those hormones matter, and it's not that testosterone is just a male hormone or estrogen is just a female hormone. We all need them, we all have them, and they all play a role.
Yep, and they might be different levels, but they definitely matter for both men and women. So that's that. Bone density is definitely something that is associated with menopause. And then something really interesting that many people may not know is that low sex hormones are actually associated with a higher risk of, we're going to talk about Alzheimer's in the future, but I want to talk about autoimmune disease and cancer. And that's because, as I said, when you are no longer able to make babies, evolution doesn't really care about you anymore. And so it's okay if you get cancer or autoimmune disease, because you're not really useful to evolution anymore. And that's a horrible way of saying it, but that's how natural selection and evolution works. So one way to mitigate that is, first of all, to take care of yourself in general, but also bioidentical hormone replacement therapy is useful for that. You replace those hormones in a natural way to sort of mimic your cycle, and you start to see less risk of those symptoms. Also, cardiovascular disease is another risk. So there's that. Is there anything you want to mention about risks associated with menopause?
Well, so I mean, we could just talk a little bit more about the Alzheimer's disease, because I think that's something that's a really big deal for a lot of women.
Yeah.
Not only do you have an increased risk of that after menopause because of the low estrogen, but also this is highly related to what we're learning now, is insulin and glucose control as well.
Yep.
And so post menopause, insulin, which is the hormone that tells us to bring glucose basically from the blood into the cell where it can be used, is one of the most important things for women to start controlling. So you have this picture where risk factors for Alzheimer's disease are the low estrogen and the insulin, and those are both things that most postmenopausal women are uniquely at risk for. So understanding that it's not just, the bioidentical hormone piece, it's also the dietary piece of it as well, and making sure that you're metabolically healthy in addition to being hormonally healthy.
Yeah, that's a huge piece of it. I have a patient right now who I gave her all these supplements and they've helped a lot, but the thing that she's noticed the most is her diet. And when she eats very clean, she has no symptoms, literally zero. And when she starts to incorporate processed foods and sugars, that's affecting the insulin and cortisol, and she starts having symptoms again. So
yeah,
very clear association there.
Yeah.
So do you want to talk about some of the naturopathic approaches? I know we talked about a little bit. Okay. So
of course I do. That's what
we're here for. So something really important, and this isn't just in menopause, this is across the board, any age that you are. We have to make sure that all of your hormones are in sync. So that's not just sex hormones. We're talking adrenal, we're talking thyroid, we're talking pituitary and hypothalamus. All the hormones work in conjunction. And so when you have a problem with one, you have to make sure you're nourishing all 3, 4, 5 of the systems, because they work together. Now, something very interesting that we need to mention is the adrenals are really important in a postmenopausal woman, because they've spent all these years basically bashing themselves and working really hard and doing 1,000 things at once, because women do that. And so when you reach menopause, not only are your ovaries tired, but your adrenals are tired, your thyroid is tired. So we have to support everything. And ideally, leading up to that time, you would have, seen one of us, a naturopathic physician, somebody who understands this stuff, to support those systems so that when you get to your menopausal years, you're already nourished enough to be able to handle it, right?
Yeah. And on that same note, so kind of like we talked about, so insulin is really important to regulate. So when you go through menopause, all of a sudden you don't have estrogen and progesterone in the same levels. So normally estrogen and progesterone are these two major hormones that are running through your body, and now they're just not there. So something has to pick up the slack, right? So this is where the insulin and the cortisol and the thyroid hormone become so important, because they're pretty much picking up the slack where estrogen and progesterone fell off.
Yep.
So, and then cortisol, what you should know is cortisol comes from the adrenal glands, which is why you're saying it's so important to support those, because now you not only have an adrenal gland who has a whole life of experience behind it, but now there's no estrogen and progesterone, and it's trying to pick up the slack by producing more of the cortisol to help balance those types of things. So, again, adrenal support, insulin, cortisol are so important to think about after menopause.
Yep. And one more thing about adrenals. Just throw this in there. Adrenals love routine. So you wake up at the same time every day, eat breakfast or whatever, brunch, whatever you eat. If you like to fast, at the same time, eat dinners at the same time every day, exercise at the same time every day, go to bed at the same time every day. Your adrenals love to know what's coming so they can prepare for it, so you can help nourish them even further by putting your life into a good routine.
That's a great point, is the fact that we as creatures run off of a circadian rhythm. So we basically run off of a yin and yang system here, like we have the active time and the rest time of the day. And so if you're not in that rhythm, everything else falls out of the way, basically. So That's a great point. I think that's a really great point. Yeah.
Yeah. Thank you. Okay, so that's that point. The next point I wanted to talk about, I mean, we've already talked about this, diet and lifestyle. That is the foundation. If my case study that I just mentioned wasn't obvious enough, really, diet and lifestyle are the true medicine. We can give you herbs and homeopathy and hormones and IVs, but what you do day in and day out really establishes the basis of your health.
Yes.
That's the end.
Yes.
Of that. No more to be said. Next, let's talk about exercise. So we're going to have a episode on exercise, I believe. But real briefly, we already talked about how bone density suffers when you don't have enough estrogen around. So that's why strengthening exercises are really important, weight training, even in the years leading up to it, to make sure you have healthy bones going into menopause, right? Not even after you lose all your hormones, your whole life building up to that time. And of course, it helps metabolically because we know cardiovascular disease becomes prevalent in the more senior years or elder years of your life. So having good cardiovascular health and metabolic health is really important. Strength training certainly helps with that.
Absolutely.
Yeah. And then of course, nutrients. Yeah, we can talk about nutrients. We know that elderly people are deficient in nutrients, especially those that impact your immune system, which is kind of why right now we're all talking about vitamin D and zinc and vitamin C and all that to support elderly with what's going on right now. But again, making sure that you have a healthy lifestyle and diet will go a long way towards helping the nutrient status of your body as well.
Yeah. One important nutrient that I see a lot of elderly people deficient in, both men and women actually, is protein.
Yeah, I was just
protein intake is, you and I are same brain. So protein is huge. Like I see, not only because of the fact that as you get older, you have a little bit of a harder time actually digesting protein because you make less stomach acid. But I also see people who tend to think that it's okay to have like popcorn for dinner or something like that, or and as you get older, protein is essential because you need it as this building block, and it's also essential for building skeletal muscle, which is protective against so many of these things that we're talking about, especially even in the context of osteoporosis. If you have a strong skeletal muscle structure around a bone that might be slightly weakened, it's less likely that you're going to break that bone because it's basically protected by a strong structure around it. So whether that be the protein that makes up your skeletal muscle or the collagen that makes up your connective tissue, you want to make sure that you have all of those factors in place. So the weight is not just on your skeleton, right?
Right.
That increases the risk of a fracture.
Yeah. Awesome. Yeah, I couldn't have said it better myself. That's so important. So protein. Y'all eat your protein, please.
Have protein.
Lastly, we're going to talk about HRT. That's kind of up to the patient. I usually leave bioidentical hormone replacement therapy up to the patient whether or not they want to do it, but it's something that is protective against all the things that we just talked about. Now, you have something interesting that you want to share about estrogen and Alzheimer's, I believe.
Yeah, so estrogen can be, like I mentioned earlier, lack of estrogen can be related to development of Alzheimer's. So bioidentical hormone replacement, for whatever reason you may or may not choose to use it for, can help to mitigate that risk. But the caveat with Alzheimer's is that you need to start using it immediately versus waiting 5 years. So another way of saying that is the risk is only lower if you start doing the bioidentical hormones during perimenopause, essentially, than if you wait till 5 years after menopause and start using it then. And this is only with Alzheimer's. Estrogen still will help, post-menopause with all of the other symptoms like, lower libido, the help with the osteoporosis, all those types of things. It is just the Alzheimer's specifically that needs to be started treated earlier in this perimenopausal cycle.
Nice. That's
and
cool.
The other thing that I really also want to stress too is that there's still a lot of stigma out there with bioidentical hormones or hormone replacement, just lack of understanding of the safety of them.
Mhm.
So the bioidentical hormones that we use now are completely different from the ones that were used back in the 70s and 80s. These are hormones that look like the hormones inside your body. So your body is actually able to metabolize, process, and use them in the same way that it would your own natural hormones.
Mhm.
And one of the things that we do with hormones to make sure that we mitigate any sort of risk of creating cancer
Mhm.
is if a woman still has her uterus, meaning she hasn't had a hysterectomy, you always give estrogen with progesterone.
That's right.
It's when you're giving unopposed estrogen that a lot of those risks happen.
Yeah, right, exactly. That's really important.
Mhm. Mhm.
Good job.
Fantastic. And so that is a short and sweet wrap on our talk on perimenopause and menopause. If you have any questions, feel free to reach out to us. You can find me on Instagram at Dr. Carly Golightly, and you can find Dr. Hoot at
Holistic Doctor Who.
All right. Thanks for joining us. We'll see you next time.
Bye.